Good morning, good afternoon, good evening, and welcome to AMN Healthcare International's live show, Onwards and Upwards, where we discuss everything a global healthcare worker needs to know about living and working in the United States. I am your host, Danielle Friedman, joining you live from the AMN headquarters in sunny San Diego, California, and we are so excited to be here today. If you are joining us for the first time today, we are AMN Healthcare International, the largest company in the United States to offer both international staffing and international direct hire options all across the United States. If you noticed, we have a new look today, but we are bringing you the same exciting information. And today we are going to be highlighting one of our amazing employers, SSM Health. So please let us know where you are watching from. We love to see where our audience is watching from, and please feel free to ask questions in the chat. We are going to be monitoring the chat and making sure to take your questions and asking the SSM Health team. So let's see who we have joining us. I know we have people from all around the world every show, and we are so grateful that you spend time with us. Hello to Bilal from Pakistan, Judith from Kenya, Azur from Ghana, Consolath from Kenya, Annie from Nigeria. Hello to everybody. Thank you so much for being here. So today, coming up on our show, as I said, we have SSM Health here today, and we are going to be meeting the leaders of SSM Health and their nurses. We are going to be exploring the SSM Health locations. We're going to be discovering what life and work in Missouri looks like, and we are going to be hearing inspiring nurse stories. And finally, we're going to give you advice on how to journey to the USA and reach your American dream. So without further ado, let's bring out our SSM Health team. Good morning, SSM Health team. I'm so excited to have you all here this morning. Love seeing all the smiling faces. So let's take a moment and go around and do some brief introductions. Please let our audience know a little bit about each of you. So I think we'll start counterclockwise from my view. So let's start with Melissa, please.
I'm Melissa Augustine. I am one of the talent navigators here at SSM Health, and I've been here for 10 years.
Awesome. Thank you, Melissa. Let's go with Darvin next.
Hi, my name is Darvin Thomas. I'm a nurse residency specialist here at SSM. I've been with SSM for 3.5 years now.
Wonderful. And Darvin, you're an international nurse yourself, right?
Yes, I am. I hail from India, but I was born and raised in Qatar.
All right. Well, I think we're all excited to hear a little bit more about your journey. Julie, let's have you go next, please.
Hi, I'm Julie Weiniger. I'm the Director of Clinical Workforce Planning, and I've been with SSM for 3 years.
Wonderful. Okay, well, we look forward to hearing from you, Julie. Diana, let's go next.
My name is Diana Zola. I'm also a nurse residency specialist. I've been with SSM for about a little over 2 years, and I'm also an international nurse from Colombia.
Wonderful. Okay, well, we look forward to hearing about how you came to America and how you're finding it. Thank you, Diana. And last but certainly not least, Brooke, let's go next.
Hi, I am Brooke Rostoff. I am the International Workforce Program Manager here at SSM Health. I am a nurse by background as well, and I have been with SSM for about 3 years now.
Wonderful. Okay, well, we look forward to hearing a little bit more about your career trajectory there, Brooke. Thank you for sharing. Okay, so if you are just joining us, we have SSM Health on today. And if you are inspired today and you would like to learn more about SSM Health, you can apply on our website. That's amnhealthcare.com/international. And you can enter the employer code SSM Health. All right, guys, I'm so excited to learn more about SSM Health today. I know you have a lot of great information for us. And once again, to our audience, please feel free to put questions in the chat. This lovely panel will be taking questions for the full session. So let's get started. So Julie, can you tell us a little bit about SSM Health? Where are you guys located and what makes you unique in terms of your mission and your care?
Yes, absolutely. And thank you so much, Danielle. And thank you so much for everyone joining us today. Really excited to have this opportunity to connect with you all. SSM Health stands out in the healthcare landscape due to our deeply rooted mission, value-driven culture, and innovative care delivery model. Our culture shaped by rich history of service dating back to 1872, when 5 German nuns arrived in St. Louis, Missouri, to begin their healing ministry. They started the first SSM hospital, St. Mary's. This legacy continues today through a commitment to equity, inclusion, and continuous improvement. SSM Health is one of the largest integrated health systems in the US, operating across Illinois, Missouri, Oklahoma, and Wisconsin. Our care delivery model includes 23 hospitals, 490 plus physician offices, virtual care services, post-acute facilities, home care, hospice, and more.
Wow, it sounds like you guys have got a lot to offer over there. So I was just writing down some facts as you were speaking. So 4 states, 23 hospitals, and you were founded over 100 years ago. Wow, so that is pretty amazing. I'm excited to learn more. Darvin, can you tell us about what your first days looked like when you joined SSM Health?
Sure. I started my career at SSM Health as an on-demand nurse. I absolutely love the culture. It is a very ministry-specific and ministry-driven culture that kind of drew me towards SSM Health. People care about each other. People care about each other's well-being, and that is a huge factor about SSM and what we do. Well-being is a huge portion of what we do because nursing itself, or just healthcare itself, is a stressful job. But when your employer supports you through providing well-being resources to help you be successful, that is a huge deal. So that was one of the reasons that I decided to make SSM Health my home. Just few, I want to say a year ago, not few, but a year ago, my wife joined me here in the United States, and she also decided to choose as her employer of choice as SSM Health. So we are, as a family, we work here at SSM Health because of that reason.
Wow, I love that, Darvin. Your wife decided to join you at SSM Health. I think that really says a lot that you wanted her to come join you and work there as a family. I love what you said about caring for each other. I think for a lot of nurses, the thought, and I'm sure you can relate, Darvin, the thought of coming to a new country, starting anew can be very scary. So knowing that you're going to a place that really cares about your well-being is probably a really good feeling. I see you kind of nodding your head, so I think you're agreeing.
Yes, for sure. And that's one of the reasons that me and Diana, our roles are created too, is to support the healthcare, the international nurses as they come in through, to help them we're more of like mentors on the unit, even help them provide resources that is available within SSM that, a lot of times people might overlook, which is actually free and available for them to use.
Well, I definitely am excited to learn a little bit more about what your role is and how it works and how you support your international nurses.
Sure.
Thank you for sharing, Darvin. Let's take a moment to turn to Brooke. Brooke, can you tell us a little bit more about your international nurse program and why international nurses are so important to your team?
Yes, absolutely. So internationally educated nurses are essential to SSM Health success for several key reasons. Like many healthcare systems across the US, we've faced ongoing workforce shortages, and hiring internationally educated nurses has become a vital pipeline to help stabilize our workforce. Additionally, these nurses often bring years of bedside experience, which helps strengthen our teams and the high quality care that we provide. And lastly, I'd say that their diverse backgrounds enhance our team's cultural competence and help us deliver more inclusive and effective care to the multicultural communities that we serve throughout our ministries.
Wow, very amazing. So can you tell us, I think you've been hiring international nurses for a little while. It sounds like it's been a long-standing program. Is that right?
Yeah, absolutely. So actually one of our hospitals, one that Diana's at, they were doing direct hire international nursing prior to this become a system-wide initiative. So it's been several years that they've been hiring kind of figuring out the pieces and doing it on their own over there. And then in 2023, it became a system initiative. So we have about 700 nurses in our pipeline that we are expecting very soon, and very excited for those nurses to start arriving. So also allows us to like build those communities within our hospitals for our nurses when they come.
Wow, that's amazing. I love that, Brooke. I think building communities so that a nurse has a soft place to land, something that feels familiar, is probably something that's very exciting for our audience to hear. So thank you for sharing. Talking about that, so Diana, what made you feel most welcome when you arrived at SSM? Darvin talked about the care and the family feel. What made you feel like you could settle in and really feel comfortable?
I mean, I think Darvin summarized it really well. For me specifically, I had a situation where, coming from a third world country, our currency isn't up to par to the US dollar. So what would be a lot of money in Colombia is definitely not a lot of money here. And having the team that I was working with, my leaders, understanding that without me knowing everyone and without everyone knowing me, they still rallied and came together and collected money to help me start my life here. And I think that speaks a lot to the heart of community that SSM has, and just the understanding that everyone, but especially in the situation, an international nurse is more than just a worker. They focused on me, and SSM focuses on international educated nurses as a person, as a whole. And I think that helped me feel welcome.
Wow. So are you telling me that your coworkers who you had just met all kind of banded together to help you when you first arrived?
Yeah. And the crazy thing is, it was before my first shift. So they didn't know me yet. They still banded together to help me. So I think that speaks a lot to the culture at Good Samaritan, which is where I work, and just SSM as a whole.
Wow, that really does speak very highly. So it sounds like they knew that it was going to be a struggle for you, and they wanted to find a way to help you when you first started. Wow, that's pretty impactful. Thank you for sharing that, Diana. I'm excited to hear a little bit more about both of your journeys. Sounds like you've both had some really, really good experiences, and that's pretty special. So Melissa, can you tell us a little bit about SSM, some fun facts, some unique things, maybe about some awards, for an international nurse who's abroad and might have different choices? Why should they consider SSM Health?
Well, as Julie mentioned, SSM was originally founded by 5 nurses that came from Germany. So we always like to say here that we had the first internationally educated nurses. As one of the largest Catholic healthcare organizations in the US, we've been hiring internationally educated nurses for over 20 years. Also, several of our internationally educated nurses have received DAISY Awards, which is one of the most prestigious nursing awards.
Wow, I love that. So you were the pioneers of international nursing way back in the 1800s.
Yeah.
That's amazing. I love that. Can you tell us, before we came on today, I was just looking into SSM Health, and I was really impressed with a lot of the awards that you guys have won and the magnet status that you have at one of your hospitals. Can you tell us a little bit about that, Melissa?
I'm actually going to defer to Brooke or Julie.
Julie, we're turning to you.
Yeah, absolutely. So SSM Health has recently won an award for being one of the top hospitals for women leaders to be a part of. It's also been so the greatest workplaces for women in 2025. Also in Becker's Healthcare, which many of you may follow Becker's. I know a lot of us on the call follow Becker's Healthcare, but it was awarded one of the top places to work in healthcare. We have one of the, for Newsweek, greatest workplaces for inclusion and diversity. and America's Greatest Workplaces for Job Starters. This really speaks to the strength that SSM Health has overall. And I will say that I've been in, my career has spanned 25 plus years, and I've been in multiple healthcare systems in different states in the United States, had amazing experiences and have loved every aspect of my career. But I will say SSM Health is uniquely special in that leadership aspect of nursing. You will find a nurse in every single level of leadership within SSM Health, from the from the ministry, the hospital department level initiatives, all the way to our system levels that are making decisions for all 23 hospitals. You will find nurses there. The voice of the nurse is extremely important at SSM Health, and we really foster that ability for you to expand and enhance your voice through education. Just like Darvin mentioned, we really want to be able to elevate, provide that mentorship, because we need to hear from our nurses, and our entire team at SSM Health knows that the voice of the nurse is so very important to continue building our mission and to really help strengthen us at all aspects of our healthcare organization.
Wow, thank you for sharing, Julie. I really like what you said about how it's about the voice of the nurse. I think clearly SSM Health really values the voice of its nurses, which is why you've won so many awards for being a great workplace. So I think that really speaks highly to SSM strengths. I also wanted to ask you, Julie, I think one of your hospitals is Magnet accredited. Is that right? Can you talk a little bit about what that means and why an international nurse should care?
Yes, no, thank you. And yes, one of our Magnet accredited hospitals is Cardinal Glennon. It's our pediatric hospital. Magnet accredited is a very robust program that requires a lot of different parts and pieces to ensure that Magnet status is reached. Some of the expectations for a Magnet level hospital include excellent quality care. So it's a lot of things that we're tracking, just how are our patients cared for? What are our processes and pieces to ensure that our patients get amazing quality care? And it also pairs with patient experience. How are our patients feeling that their care is going? How is their experience going for our patients and their families? We have an incredible team at our Cardinal Glennon, our pediatric hospital, and they do an amazing job there. And a lot of their processes and procedures are being adopted across the board with many of our other hospitals. We are very much value continued improvement and monitoring and watching and data analysis with all of our quality metrics, and being able to really see who's doing things well, and then leaning in, having some shared learning and being able to replicate things. So it's been really fun. We have some hospitals that are getting close, moving toward magnet status, and Cardinal Glennon has achieved it for several years.
Wow, that's amazing. That's a tremendous achievement. I know, for those of you who are watching around the world, Magnet is kind of like the gold standard of excellence for a US hospital. So the fact that one of SSM Health's hospitals has Magnet status and others are working towards it really speaks very highly. So thanks for that background, Julie. So I want to turn to the AMN partnership with SSM, which we are so excited for. We have already hired some international nurses. There are plans to hire more. And I know for a lot of you who might be watching, you might be thinking, how do I make myself stand out? I'm learning a bit about SSM. I'm going to learn a little bit more. I might be interested. So we're here to give you the answers. So Brooke, I'm going to turn to you first. What is SSM Health looking for in terms of specialties and skills, and how can international nurses who are watching along with us today really make themselves stand out?
Absolutely. So currently we are looking for ER, ICU, OR, and CVOR nurses to join our team. That doesn't mean down the road we wouldn't be looking for other specialties like tele, step down, med surg, but right now those are our main focus areas. And for nurses interested in working with SSM Health, some of the requirements that we have are we do require you to have passed the NCLEX, have a minimum of 2 years bedside experience, and currently be working in the specialty that you're interviewing for. And while we don't require it, we do love to see nurses who've had experience with electronic health records as well. And then I would say an applicant truly stands out to us when they allow their personality to shine. We genuinely want to get to know you. We want to know what inspired your journey into nursing and what draws you to continue that journey in the United States. Hearing about what your passion is for patient care, your goals for your career growth, helps us align you not only with the best hospital within SSM Health, but also with the best department that fits your experience and supports your future growth.
Okay, thank you for sharing that, Brooke. That's, I'm sure, very helpful. I saw we had a couple of questions in the chat about how to apply and what's the criteria. So hopefully this is helpful for you, Warshawn. If you do want to apply, you can apply on our website. That's amnhealthcare.com/international. And you can type in the employer code SSM Health to be put on that list and get more information about SSM. So Darvin, I want to turn to you. What advice would you give to an international nurse that might be thinking about joining the SSM team? Why do you think it's a really great place for international nurses to work? Well, on mute. There we go.
There you go. So I think one of the biggest piece of advice is believe in yourself. You got this. You have all the resources available here at SSM Health. You have dedicated residency specialists that will check on you, make sure that you have all the resources and you're successful. Our leaders also understand that you are coming in from an international perspective, and all of us here have been trained on, helping international nurses. So they do consider that into fact. I think one of the biggest thing that I took before moving to the US is I used to watch a lot of sitcoms. It kind of helped me understand a lot of verbiages, dialects, cultural practices. It kind of made me understand what it is, because we don't celebrate Thanksgiving back where I was from. I lived in Qatar and India. We never celebrated Thanksgiving. Those kind of cultural nuances, I think it was a fun way to watch. Sitcoms are funny, they're easily available, and you kind of learn cultural stuff. But for sure, SSM does have all those resources too. You have dedicated residency specialists, and your leaders are always there to go above and beyond to help make you be successful in your role.
I love that, Darvin. I've been talking to international nurses for many, many years now, and I love hearing about how a lot of you will watch Friends or Seinfeld or different sitcoms just to learn English. I think that's great advice. Learning about cultural norms, Thanksgiving, Christmas, all of that kind of stuff, because it's very different in the United States.
For sure. Yeah.
So Darvin, I just want to follow up on something that you said. So we talked a little bit about this nurse residency specialist. What does that mean? You mentioned mentor. It sounds like it's a very helpful person to an international nurse, but could you explain what that is?
Sure. So SSM Health realized that there is a need to help support international nurses and newly graduated nurses in the United States. So they created a job profile, like it's called Nurse Residency Specialist. So most of us have experiences working bedside, and we still, are available throughout the clock. That is one of the nice things about being a residency specialist. If you work night shift, we come and check on you. We've also done things like where there is some issues where there is a time issues with time management. We come sit with you, we shadow you guys, we make sure you're comfortable. I think the biggest way, or the easiest way to describe our role, is we're like big brother, big sister kind of a role. We're not your bosses. We are an external factor that help you be successful. We teach some of those classes to help you integrate into healthcare in the United States. And most of us are, trained nurses, experienced nurses who have already gone through these process of being, dealing with new graduates, dealing with international nurses. And also we have good relationships with most of the leaders, and we always are in constant communication with them. I think it is more like a big brother, big sister role to help you be supportive, to help you through, through your role. Orientation is very varied across whatever areas you've been hired into. Some areas have extensive orientation just because of the the area that they are in. But a mentor is somebody who is beyond that orientation phase, where they are making sure that you're successful. We also talk about professional growth and development, how we can help you. SSM has resources to help you with your professional growth and development. You decide to be a preceptor, you decide to be a charge nurse. How can you do that? How can you achieve that? So that's what a mentor is. It's a long-term goal. Even so, the residency is mostly a year, but past a year, we are there to support you and help you be there. And we always check on you, and we've always created good connections with our residents and our international nurses. So that's what we do. I think in a capsule, it's more like a big brother, big sister looking out for you kind of a role.
Wow, I've been doing this for a long time, and I've never heard of a program like this where it's a big sister, big brother mentor that's more than just the initial time that you arrive, somebody who's really there for you throughout your whole time at the hospital. So that's a really special program, and I can hear when you speak, Darvin, that you're very dedicated to it, and it sounds like a very thoughtful program. So thank you so much for sharing. I really enjoyed hearing about that. Diana, I want to turn to you. You are also a nurse residency specialist. What do you think it is about SSM Health that helps internationally trained nurses really thrive?
Well, I think, first of all, SSM Health has the desire to help international nurses thrive. It's not just about having workers fill a spot. It really is about how can we support them to thrive as professionals, to thrive as people in their personal lives too. So even to piggyback on what Darwin was explaining from or about the nurse residency program, we are there to support you. Basically, the nurse residency program was established for newly graduated nurses and internationally educated nurses. So to know that there's a program like that that focuses on you as a person, that mentors you, that supports you, that has people that are big brothers and sisters, I think that shows how much SSM wants the international nurses to thrive. So I think it's such a unique, special thing that SSM offers, with a team that is dedicated to the international nurses, and at the same time, a team that's composed of people that have a passion for teaching, for supporting, for mentoring. So I think that really makes a difference when it comes to helping an international nurse thrive.
Wow. Well, thank you for sharing, Diana. I saw you got a shout out in the comments. Mike M says Diana is the kindest and the sweetest. So maybe Mike M knows you from your nurse residency specialist role, but I love how you said that it's not just about a person filling a spot. I think when you're coming to a new country, it's very scary to imagine starting fresh, starting new, and having that support and that mentorship can really make a huge difference. So thank you for sharing, Diana. So Melissa, I want to turn to you next. We talked a little bit about where SSM is located across the 4 states, but can you tell us a little bit more? Where exactly is that for somebody who doesn't know very much about the US? Where are SSM facilities found?
Well, yeah, so SSM operates a wide network of healthcare facilities across 4 Midwestern states, which include Missouri, Illinois, Oklahoma, and Wisconsin. So we have hospitals in both rural and metropolitan areas throughout these states, which really kind of allow us to find that best fit for nurses' lifestyle. Our Missouri hospitals are in St. Louis region, and we do have 1 hospital in Jefferson City. Our Southern Illinois hospitals are both located in small rural towns. Wisconsin does have 1 hospital in Madison, which is more of a mid-sized city, with the remaining hospitals in smaller rural towns. And then finally, our Oklahoma hospitals are in Oklahoma City and the surrounding suburbs.
Okay, Melissa. So thank you for explaining where SSM Health is located. So if you are following along, it sounds like SSM Health is pretty much smack dab in the middle. They're in the Midwest. They're taking over kind of that whole middle half. Let's bring up that state map again so we can see where SSM Health is located. And you could see Right there, right in the middle, a huge presence in Wisconsin, Illinois, Missouri, and Oklahoma. So you could see all throughout there. I think today, let's focus a little bit on Missouri and let's learn a little bit what life is like in Missouri. Hopefully in future showcases, we'll have you all back on to learn about the other states. But let's talk about Missouri a little bit more. I've actually been to St. Louis. It is a beautiful city. I wasn't expecting it. It is such a beautiful city, and I'm excited to learn a little bit more about what life is like there. So, Julie, can you tell us, where is Missouri geographically speaking? Where is it located in the US, and where are SSM facilities found in Missouri?
Yes, thanks, Danielle. As you could see, Missouri is really the heart of the country. It is a state that borders 8 states. That's more than any other US state, making it really a key hub for transportation overall. It is home to 2 major cities. As you can see St. Louis in the east and Kansas City in the west.
All right. Okay. Thank you, Julie. So the center of the country, right in the middle, which I think makes it pretty easy for traveling all across the US. And we're going to learn a little bit more about that. I see there are lots of questions in the chat and a lot of people saying hi. So I just wanted to give a quick hello to some of you who are watching. Hello to Mary, who's watching from Zambia. We have a lot of people asking questions. So we also have our recruiter who is taking questions in the chat if we aren't able to get to them today. So please continue to ask your questions. And as time allows, we will ask the expert SSM team about them. So I have a little bit of fun fact trivia I would like to ask all of you and our audience to answer. So let's see how well you know your home state and home country of Missouri. So what is the nickname of Missouri? Is it the Sunshine State, the Show Me State, or the Volunteer State? If you're following along, please put in the comments. Do you think it's A, B, or C? And I'd love one of the St. Louis residents to tell us, what is this picture of? So I see everybody's kind of smiling. Melissa, I see you smiling. What is this picture of?
Yeah, it's the arch.
That is a famous St. Louis landmark. I definitely went there when I came to visit. It's very beautiful. Looks like it's right on a lake or a river of some sort.
Yeah, it's on the Mississippi River.
Wow. Okay. Very cool. Very beautiful. So let's see. One of our St. Louis residents. So I see everybody smiling. Brooke, do you know what the nickname is for Missouri? Is it A, B, or C?
It's B, the Show Me State.
B, the Show Me State. I see we had a couple of people who got that right in the chat. Good job to Fatima. Good job to Milanis. You got it right. All right. What is our next trivia question? We're going to learn a little bit more about St. Louis. So if you have been following along in pop culture news, you might know this one. So the fiance of Taylor Swift is a player for which professional American football team based in Missouri? So if you have been watching along, you know that in the United States, football is a big thing. People love their football. It's a lot of fun. We're in football season now. Is it A, the Green Bay Packers, B, the Dallas Cowboys, or C, the Kansas City Chiefs? Where is Taylor Swift's new husband to be? Where does he play? Which team? I see we got a few answers in the chat. Let's see. Julie, do you know this one?
Danielle, I was nervous you were going to call on me because I don't follow Taylor Swift very well, but I'm going to take a guess. I think it's C. Is it C?
You made a good, educated guess, Julie.
I'm relieved.
Now you know your football knowledge. The Kansas City Chiefs. I know there are 2 major cities in Missouri. One is Kansas City and one is St. Louis. So that was a good, educated guess. And looks like quite a few of you got that right. Milanis got C. Evelyn got C. Paul got C. Everybody's learning their American football. And I think we have one more trivia question to ask about Missouri. Which U.S. city in Missouri is known as the Gateway to the West? Is it A, St. Louis, B, Kansas City, or C, Springfield? I see a lot of you are answering the question in the chat. We love to see you getting involved. Let us know. What do you think? St. Louis, Kansas City, Springfield? Brooke, can you give us the answer, or at least what you think it is?
St. Louis.
Okay, I think that is correct. St. Louis is the gateway to the West. And I see we have lots of people who got it right. Congrats, Annie. Congrats, Rhoda. Love to see everybody getting involved in the trivia and learning a little bit more about Missouri and all that it has to offer. So I would love to hear a little bit more from Melissa. What's it like living in Missouri? What's it like living in St. Louis? What are the fun things to do? Why did you choose to live there? Can you tell us a little bit about it?
Yeah, I would say the true highlight of living in St. Louis, it's just a perfect blend of family-friendly living. It's rich in culture and really the affordability. Nurses and their families can really enjoy a vibrant lifestyle with access to top-rated schools. We have many beautiful parks and a lot of free attractions like our St. Louis Zoo and Science Center. I'm a big traveler, so if any of you like to travel, St. Louis is centrally located, so it makes it very easy to travel to various locations throughout the U.S.
Love that. Okay, thanks for sharing, Melissa. So if somebody is thinking they want to move somewhere that is family friendly, has lots of things to do, easy access to the rest of the US and the world, it sounds like St. Louis might be a good fit for you. You also mentioned affordability. You know, Diana, you kind of touched on this, but moving as an international nurse can be scary. It can be expensive. The cost of living is very different from a lot of places around the world. And a lot of nurses may want to consider the cost of living in the place that they are moving to. You know, I see Darwin kind of going like this. I think he agrees. It's an important factor. Brooke, can you tell us a little bit about the cost of living in Missouri and how it might compare to other places in the U.S.?
Yeah, absolutely. So Missouri is known for having a moderate cost of living, which is lower than the national average in the U.S. This kind of means that your salary goes a little bit further. Housing, groceries, and other daily essentials are generally more affordable here. And like Melissa said, we do have a lot of free options here. So the zoo, a lot of our parks, science centers, there's a lot of things that you can do that you don't have to even pay for. A lot of free concerts that go on in our parks, yoga classes that go on. So a lot of opportunity to have a full day of activities without even having to spend any money.
Well, that's always good. We always like to hear that. So I actually decided to do a little cost of living calculator between St. Louis and a couple of US cities. We did a cost of living calculator between St. Louis and San Francisco, which is in California. And we found that the cost of living is 91% higher in San Francisco. You can see all those different costs. Housing costs, 278% higher. Transportation costs, 45% higher. Food costs, entertainment costs, healthcare costs. Whether you're coming with a family or as an individual, it's definitely important to take into consideration what different things are going to cost when you arrive in the US. I think we also did another comparison to another major city, St. Louis versus Manhattan, New York, and we found that the cost of living is 157% higher in Manhattan versus St. Louis. So huge affordability factor for nurses who are considering a place that would be more affordable for you, more affordable for your family. So definitely something that you want to be taking into consideration. I see we have a lot of questions in the chat. So we're going to take a couple of the key ones. So Julie, I think this question will go to you, but if not, feel free to give it off to somebody else. Yutonde is asking, what is your nurse-patient ratio? Is that something you can maybe speak on?
Yeah, absolutely. And thank you for the question. That's always really important. As we look at nurse-patient ratio, we take into account the care that the patients are needing. In general, in the medical surgical areas, the nurse-patient ratio is about about 6 to 1. It can be as low as 4 to 1. It depends on the acuity level of the patient, if how much needs the patient has. But it really is between 4 and 6, and I think it generally is between 5 and 6. I'm going to ask Darvin if that is correct. I know that you're at the bedside frequently, so I'm just going to make sure to fact check myself if you have anything that you wanted to add.
Yeah, for sure. Six. Well, six is a number, but I mean, it is like when it's super short, or again when there is an acuity kind of situation. But most of our med surg units here in Oklahoma, we have it between 4 and 5. We rarely do get 6. But we do have nursing assistants that help us out with our patient care too. That's in med surg area. And if you go to like a higher acuity area, like step down and critical care, the ratios are much more lower. But again, the patient is more, the acuity is higher too at that point.
Okay, great. Thank you, Darvin. I'm sure that's very helpful for our audience. We're going to take one more question. So Brooke, I'm going to turn to you for this one. So Annie is asking about the crime rate in St. Louis, and I wanted to hear a little bit about your experience. Obviously, you all live there, and we want to hear a little bit more about your experience, or if this comes up as an issue for you.
Yeah, absolutely. I would say I don't know specifics on the statistics of crime in St. Louis, but I would say if you're out there Googling it, you are probably getting some feedback that it is one of the most dangerous cities or something along the lines of that. However, what I would say is that, like most cities, there's areas that you should avoid going to, especially at night by yourself, things like that. There's a lot of really good, safe areas. I walk and run throughout the city by myself early in the morning. I've never felt, uncomfortable or scared or, like my safety was in jeopardy. But I think it's all about that situational awareness, making sure that you're not going alone to places. And then just kind of knowing the areas that you're going to. Like I said, there are a few areas that you probably should avoid, but the majority of the city is very safe and you're able to navigate it without any problems.
Okay, so thank you for sharing your experience, Brooke. So hopefully that helps you kind of understand Annie. I think if you're looking at going to any major city in the United States, there is going to be some pocket of an area that you may want to avoid no matter where you're going. So I think that's a good question, but you also need to take into consideration where you're going, the type of city, and the fact that truly anywhere in the world, you just want to be alert and careful. So I think that's a good question, and thank you, Brooke, for taking that. So I see we are kind of closing in on time, and we still got a lot to talk about. So there's something I want to turn to and focus on, and that is career development. So I have been talking to international nurses for many years now. And I think, when I first started this job, I thought most international nurses wanted to come for better opportunity, and maybe that meant better financial opportunity. But in my conversations with a lot of international nurses, it seems that career development is actually such a key part about coming to the United States. I see Diana and Darvin both going like this. I think that's a huge reason why a lot of international nurses think about coming to the US. So let's talk a little bit about what career development could look like for an international nurse. So Julie, I'm going to turn to you. Can you tell us a little bit about what that might look like for an international nurse and what opportunities there are at SSM Health?
Yes, there really are endless career paths for nurses at SSM Health. Whether you'd like to remain at the bedside and continue growing and honing your clinical skills at the bedside, we support that. If you'd like to step into leadership roles or into roles that support nursing in general, like continuous improvement, quality improvement, we will lean in, and we have a lot of programs to support your future growth, both with resources of finances and time and mentorships to be able to really help you investigate and see where you would like to grow. SSM Health offers tuition reimbursement as well as reimbursement for certain certifications. We know you coming here to work with us is you investing in us and really giving the most valuable thing ever, which is your time and talents. And we want to invest back in you. And so this is really our opportunity to do So there are many opportunities for nurses to get involved in their ministry as well as the organization in general. Some examples include a mission action team, unit practice council, nurse practice council, and more. And with Darvin and Diana, it's all the way up to one of those mentors, being able to help nurses grow and have great experiences, and being able to really share and lean in and be able to really share and expand your talents.
Wow, that is pretty amazing. And I think a true testament seeing Diana and Darvin both starting out as nurses and now as nurse residency specialists. Darvin, could you talk a little bit how your role has changed and grown as you've been at SSM Health?
Yeah, for sure. So I started off as a float pool nurse, and I was I was precepting newly graduate nurse and also agency nurses. Preceptorship, I always think, is your first stone or first brick for the career development. There is a lot of opportunities here. They do have preceptor training, so they train you to be a preceptor. We have numerous resources available. And then I was asked to step into a role of a charge nurse. Also, we have charge nurse training. So either you're shadowing a charge nurse for a couple of shifts to get to hone those leadership skills, and also those virtual classes at the comfort of your home, which SSM provides you to help you understand what different responsibilities of a charge nurses are. And then, I am also a nationally certified medical surgical registered nurse. SSM also does a lot of programs where they do review courses in whatever areas that you're in. So if you're in critical care area, the national certification is CCRN. If you're in med surg, it is CMSRN. If you're in step down unit, it's a different one. So they have review courses, review programs. They also help with some of the reimbursements for that. If you decide to go for like BSN or your MSN, they have tuition discounts and all that. So my role, I also was nationally certified as a medical surgical nurse at that point. And when this role opened up, I was very interested because this is something that I've always loved, teaching and mentoring and precepting people or nurses. And I think it was a really good fit for me at that point, and I still feel it's a really good fit for me.
Wow. Well, I can tell from your confidence and your smile that you feel really happy about your journey, which I think is a huge testament to the support and the community that you clearly have found at SSM Health. So that's very inspiring to hear. Thank you for sharing your journey, Darvin. So, Brooke, I want to turn to you. Darvin mentioned mentorship, trainings, a lot of things that he's experienced at SSM Health. Can you tell us a little bit more about the mentorships, the trainings, any kind of upskilling that SSM provides to its international nurses?
Yes, absolutely. So we do have several different types of mentorship that we provide to our internationally educated nurses. As Darwin and Diana both mentioned, these nurses will all be going through our nurse residency program, which is about a year-long program with various classes taught by Darwin and Diana, as well as our other nurse residency specialist. And something I should mention is each of our ministries have a nurse residency specialist or two, depending on the size of the ministry. So our larger ministries will have two, just to ensure that they're able to touch base with everyone. And so while you're in this year-long course and going through your orientation, these nurse residency specialists will be checking in with you to make sure that everything is going smoothly, you're progressing to coming off orientation, to make sure that there's no issues with like the preceptor. Sometimes personalities just don't match up and we want you to be successful. And so pairing you with somebody else might be the right step or the right option to do at that time. And that's kind of all driven by the nurse residency specialist. We've also identified a gap with some of our internationally educated nurses in not having as much experience with electronic health records. And so we've added in an additional EPIC training for all of our internationally educated nurses that they will take prior to going on the floor. So before they're in a patient setting, they can really be comfortable with the charting and the different systems that we use on the computer. And then lastly, I would say something that's been recently added is our HealthStream platform. And so in the US, we do a lot of online learning and continuous education, a lot of yearly criteria or metrics that have to be met through that. And so this health stream is for our new graduate nurses and our internationally educated nurses. And it really allows us to develop a very personalized plan for you. And it kind of guides you through different scenarios, and you kind of do it at 3 months, 6 months, 9 months, and it really allows us to tailor your education to ensure that you're getting what you need from us before you're on your own.
Very interesting. Wow. There's a common theme I'm hearing a lot from all of you. Brooke, you mentioned the word personalized. Diana mentioned that you're not just filling a spot. Julie's talked about your programs and your mentorship, that it's one-on-one. I think it really goes to speak to the strength of SSM Health in that you really value each individual nurse and where they are in their journey. There's not a one size fits all is what I'm hearing from this team, which I think for an international nurse who might be coming from another country and might be feeling a little anxious, as I'm sure Darvin and Diana can relate, it's probably music to their ears to hear that their individual journey is really taken into consideration. So thank you all for sharing that. I think that's really unique and interesting, and I've really enjoyed hearing about it. Brooke, I have a follow-up question for you. So Jericho is asking if you are looking at PACU nurses. Can you share again, in case Jericho or anybody else may have missed, what kind of specialties are you guys looking for?
Yeah, absolutely. So right now, I would say we're really specifically looking for ER, ICU, OR, and CVOR. However, we're always kind of looking for everything. Those are just kind of our hot spots right now. But I would say PACU does kind of fall into that OR setting. And so, yeah.
All right. Well, there you go. So if you are interested in applying, and I see we had a question from Shibuzar who's asking where to get the link. If you have been inspired by the SSM Health team and you would like to apply, you can apply on our website. It's amnhealthcare.com/international, employer code SSM Health. Please feel free to click on the link in the chat and submit your applications today. We look forward to helping you find your placement at SSM Health. Okay, so Melissa, I want to turn to you for one last question just on career development at SSM Health. What advice would you give to international nurses that are now maybe watching along and they're excited about potentially starting their career at SSM Health? What would you say to these nurses?
Well, there's probably a few things. I would say, stay involved throughout your unit and your ministry. I think there's a lot of opportunity for you to get involved and be engaged that will really, truly allow you to both grow professionally and personally. I would also encourage everyone to talk to their manager. I think it's really important to talk to your manager about your career path and your growth so they can really help you to meet your goals. Also, take advantage of our tuition reimbursement. We have a lot of staff members that use our tuition programs to further their education. And I would say finally, ask for and be open to feedback. There are a lot of great mentors within SSM that can help guide you as you progress through your career.
Love that. Thank you for that advice, Melissa. I think that's good advice for anybody who's thinking they might want to start at SSM Health, but also grow their career. Really take advantage of that career development. I see lots of nodding heads, so that is good. So I would love to ask Darvin and Diana, I actually had somebody recently ask me, why are you in the healthcare industry? Why do you like working with international nurses? And I told them why working at AMN was important to me, why it feels like a family to me. I'm actually an immigrant. I'm originally from South Africa, and I love to think that my job is involved in paying it forward and helping other people reach their American dreams. So that's something that's really important to me. I'm going to pose the same question. Let's start with you, Diana. Why do you like working in healthcare, and why SSM Health?
I think that's a really big and deep question. Excuse me, but there is a heart behind serving people that I love, which is hard to describe. But getting to know people, whether it's during the hardest time in their life or the best time in their life, I think allows for a different type of connection. I can recall so many situations with different patients that I was or had a chance to interact with, and having SSM, we have a, like in the system, we have a concept or an initiative called Commit to Sit. And that's an initiative that wants to encourage nurses to sit down and get to know their patients. And I think every time I hear, whether from leadership or nurses amongst themselves, encourage one another to sit down and get to know their patients, it reminds me, this is why I became a nurse. It's to be with people, to connect with them, to get to know them better. And in terms of working with international nurses, I grew up in the States. I lived here for a couple of years when I was little, moved back to Colombia, and then came back here. My entire family has dealt with experience what it's like to move to another country, not knowing the culture, not knowing the language. And it's very frustrating. It's very hard. And knowing that I can be support for that kind of process for different people coming, it's kind of like a pay it forward type of situation, but it's also, I'm very aware of how difficult it can be. And I don't want people to feel alone in that walk or in that journey.
Very inspiring, Diana. I could see everybody's faces backstage. I know you as the audience, you couldn't see, but everybody on this team was going like this. So you can really see it's about the heart. I can really feel that from your testimony, Diana. So thank you for sharing that. I also love that initiative, Commit to Sit. I think that really speaks to how, once again, the individual is such a valued part at SSM Health. Darvin, I'm going to turn to you. What's one moment, big or small, that's really made you proud to work at SSM Health?
I think just want to piggyback on what Diana is saying. Definitely the different initiatives that SSM has that focuses on not just nurse well-being, but also, at the end of the day, our patients' well-being too. Diana was talking about Commit to Sit. I also want to talk about managing up, which is something that we do. When we do handoff or when we send our patient off to a different unit, we always manage up those units, like saying, hey, you're going to be in good hands. There are a lot of experienced staff there that will take good care of you. Also, the mission behind what SSM does is something that always resonates with me, and I think that is the reason that I feel like I feel connected to SSM Health.
Love that. Thank you for sharing, Darvin. Really, really enjoyed hearing about your and Diana's journey and experience and moving up at SSM Health and why you've both chosen to stay. I think that really is what speaks volumes. So I see we're almost at time. I want to give everybody one last chance to give a final piece of advice for an international nurse who might be considering coming to the United States, might be considering SSM Health. So Brooke, let's turn to you first. What would you say to our audience that may be inspired and are now considering going on this journey with SSM Health?
Absolutely. I would say if you're an internationally educated nurse who's interested in working at SSM Health or even anywhere in the US, to ask lots of questions and get informed about every part of the journey, learning about the immigration process, understanding how US healthcare systems work, understanding the different roles and different career growth opportunities, and exploring what nursing looks like here. I think those are all good things. The more informed you are, the smoother your transition will be, not only professionally, but also personally.
Good advice. Good advice. Thank you, Brooke, for sharing. Melissa, what about you?
I like how nursing gives you that opportunity to work with different types of patient populations in different settings. So I would say the same, like it's the opportunities both professionally and personally.
I love that. I think, just hearing what Brooke and Melissa are sharing with international nurses is really that it's about taking advantage, taking your journey into your own hands, making sure that you make it happen for yourself and taking advantage of the opportunities that are around you, both personally and professionally. So whether that looks like career development, whether that's exploring your new home, whatever that looks like for you. So if you were inspired today by the SSM Health team, please apply on our website. That's amnhealthcare.com/international, employer code SSM Health, to learn more about the SSM Health team. So thank you so much to Darvin, to Diana, to Melissa, to Brooke, and Julie. I think we might have lost her, but thank you all so much for being on here today. I really, truly enjoyed hearing about SSM Health, hearing about all of your different roles and your different journeys. I found it very inspiring, and I'm sure our audience did as well. So thank you for being on with us today, and hopefully we look forward to having you on again in the future. Thank you all.
Thank you so much.
Thank you.
Thank you.
Okay, so if you were inspired by this amazing SSM Health team panel, please apply on our website. That's amnhealthcare.com/international, employer code SSM Health. Our recruiters are on hand, ready, waiting, and excited to help you process your application and reach your American dream. So let's pull up our show schedule for the next month. We are going to be having our Onwards and Upwards show at 7 a.m. California Pacific Standard Time. In September, this is going to be a big one. The October visa bulletin comes out. This is when the year resets, and we are going to be going live the day after the bulletin comes out. So that's why it says TBD, because we're not sure when it comes, but we are going to be having our immigration Q&A with our legal experts. They will be taking your questions live. So fingers crossed for some good news there. We also are going to be having another Onwards and Upwards show on September 26th, so make sure to tune in. We also have our AMN Academy shows, which are every Monday, 6 a.m. California Pacific Standard Time, with our partners 9.09er and iPass. And we have a new show on the fourth Monday of every month. We are going to be talking about Dream Jobs with D. So don't miss out on your opportunity to learn more about what current roles and current employers are hiring. So thank you all for joining us today. Thank you for all of the comments in the chat. Thank you for joining us. Hopefully you were inspired and choose to come with us to the United States and reach your American dream. Thanks you all for joining us, and we will see you all soon. Onwards and upwards, everybody. Bye-bye.